Welcome to Marian Ayurveda. In this first episode, we are going to discuss acute ear pain or ear discharge and the condition where the eardrum ruptures, which commonly occurs in children. However, adults can also experience this. In this episode, we will learn how Ayurveda can be used to manage this condition right from the beginning. Generally, when we experience pain, there is a common perception about Ayurveda that it takes a lot of time. But let's see what the reality is. Without delay, what are the ways to reduce pain within just 5 or 10 minutes? What are the dietary habits that can help? And what should people who experience ear discharge be careful about? What should you pay attention to when using oil in your diet? In this episode, we will be discussing all these aspects. I am Dr. Anumod Kakkassery from Marian Ayurveda, Thrissur. First of all, when it comes to ear discharge or ear infection, we can categorize it into 3 stages. In the first stage, we know that the disease is called otitis media. We refer to it as either acute otitis media or chronic otitis media. The term media refers to the middle part. We know that the ear has 3 chambers, right? One is the outer part that we can see. Then there is a middle layer, the middle part, and inside that there is an internal layer. So there are 3 parts to the ear. It is the infection that occurs in the middle ear that causes us to experience ear pain and sometimes ear discharge. So when the infection affects the middle ear, we call it otitis media. In the initial stage of otitis media, the main symptom experienced, especially in children, is ear pain. The pain tends to worsen at night. Generally, children who end up in casualty are unable to tolerate the pain at all. In the initial stage, when children or even adults experience severe ear pain, we can try to manage the pain at home at the initial level without immediately going to the hospital. However, if there is any discharge, you definitely need to go to the hospital. First, we think about how to reduce the pain at the initial level. I am Dr. Anumod Kakkassery, Marian Ayurveda, Thrissur. So there are many people for whom we have done this, and it is a method that has been very successful. The issue is fluid accumulation in the ear. What we need to understand is that if a child or a person complains of ear pain, there is still a small amount of fluid trapped inside their ear. This is something we need to realize. Now, what can we do to reduce this fluid accumulation? In Ayurveda, what I would suggest, and what we have found to be a very effective method, is fumigation, or applying smoke to the ear. After trying dry methods or using oil-based treatments, sometimes the pain can become much worse. At such times, you should never use oil treatments in the ear. What you should do is fumigation. When I say fumigation, I mean drying out that area using smoke. So what kind of smoke should we use and what should we do? The simplest and most easily available option for us is asafoetida, kuntirikam. If you have some asafoetida at home, when this ear pain occurs, whether it's for a child or an adult, you can place a bit of asafoetida on a piece of hot coal and let the smoke enter the ear. This can provide instant relief from the pain without having to go to the hospital. Similarly, if you have any medicine that can reduce fluid buildup, you can administer it internally. If you do that, the relief will be quick. So in the initial stage, what we need to pay attention to in children with ear pain is when they are having oil applied to their head. It's not very good, as there is a chance for fluid buildup to occur quickly. The same applies even if oil is being applied. Never add things like black pepper or tulsi to it. Avoid adding such ingredients. When you add things like aloe vera or similar substances and prepare oil with them, there is a higher chance of fluid accumulating in the ear. So the next point we can mention is to avoid using such medicated oils likewise. If children still have fluid coming from their ears, it is most commonly seen when they have a cold. That's why it is extremely important to completely avoid foods like biscuits, milk powder, and health drinks that contain such ingredients, as these are the most problematic for them. Ear pain can also be caused by applying oil or giving such things. By paying attention to these matters, we can change these habits. Similarly, exposure to smoke can also contribute. Now, regarding the medicine to clear the fluid buildup, I will tell you which one it is. You should consult a doctor to understand this properly. If you keep this medicine on hand when the first signs of ear pain appear, you can give this medicine 2 or 3 times and use steam inhalation. After that, the child's ear pain can be easily relieved, which is what I want to say next. Ear discharge. When the eardrum bursts and pus starts coming out, we call this condition suppurative otitis media, where pus is discharged from the ear. This is an infection. So what can be done in this situation? In Ayurveda, there are very effective treatments for this. There are many medicines in Ayurveda for this, and if you use them properly, this disease can be cured quickly. Otherwise, depending on the stage, sometimes the pus may come and go, or for some people it may persist continuously without ever fully healing, and in such cases surgery is often recommended. So when it reaches this stage, how can we treat it through Ayurveda instead of surgery? That is what we are going to discuss now. We have treated ear discharge before, and with our Ayurvedic medicines, using both the fumigation method and the internal administration method, we have been able to cure it. So in the initial stage, we can talk about it a bit more generally. When I mention this, I'm reminded of an incident with a friend of mine who had a similar issue. Normally in Ayurveda, when we prescribe a medicine and use it for about 5 to 7 days, the condition usually resolves and the discharge dries up within 2 days. But in this particular case, no matter what was done, the discharge was not going away. So we thought the medicine was correct. But when the illness wasn't improving, we started wondering where exactly the problem was. We searched a lot, tried changing different foods, and finally realized that the issue was with the milk powder this person was using. They were using milk powder to make tea. Then we understood that this milk powder was the only foreign body, the only unnatural food being consumed. So we decided to try eliminating it. After removing the milk powder, by the second day, the discharge or oozing from that person's ear had stopped. That's why I always ask everyone who comes in with ear discharge whether they are consuming any health drinks or products containing milk powder. Often these can cause significant problems, as we've noticed in cases of ear pain. In this case, they stopped using milk powder and took an Ayurvedic medicine. Within 5 days, we could see that we were able to cure the disease, and after that I had several patients who had been indicated for surgery or those with conditions that never seemed to improve. What we did here was use this smoke therapy. When applying the smoke, you have to be very careful. The heat from the burning ember should never touch the ear, only the smoke should enter the ear. If the hot ember or strong heat touches the ear, the discharge will never stop. As we already know, in such cases, the drum is already red and inflamed. Therefore, the heat should never touch the area, only the smoke should be allowed to reach there. If we consider taking it through the nose as well, we know that nasal blockages can also cause discharge in the ear. So even in chronic cases, we use this same smoke therapy. And in terms of diet, we should also mention oil in the food regimen. Those who use it have mentioned this before as well. What we are actually doing is foolishness when we say we should take steam. Often when we have a blocked nose or ear pain, we take steam to open up the nose. But this can cause serious problems. When you take steam, you are applying heat, and if you are already suffering, the congestion increases. Therefore, you should never take steam for a blocked nose or ear pain. In any kind of pain, steam inhalation is not allowed, especially after the heat hits. What we are actually doing is applying pressure to the pain, and in chronic conditions we need to move to a different method. This is one such method, which quickly penetrates inside and helps to dry it out. In Ayurveda, there are several medicines or rasayanas that are used for this purpose. When we talk about rasayanas nowadays, like Chyawanprash and other such tonics, if used regularly in the right amounts, it has been possible to cure persistent ear discharge and similar issues. So, for those who have ear pain or persistent ear discharge, it is important to reduce spicy and sour foods in your diet. Also, avoid foods that can cause allergies, and if you are drinking tea or coffee, try to stop. Reduce the use of milk powder and avoid steam inhalation. Pay attention to these kinds of things. By doing so, we can eliminate ear pain to a certain extent. We'll see you again in another episode. Thank you.